Hello, my name is Lucretia Cornell, aka Tam, and this is my video on sheep heart dissection and anatomy identification. Starting with the surface vessels, we find the superior vena cava, and that goes into the inferior vena cava, passing the probe through, inferior vena cava, superior. Then we come to the pulmonary trunk and the aorta. And we can also appreciate the brachiocephalic aspect of the aorta. Flipping back to the posterior side, we see the pulmonary veins covered in fat, adipose tissue. For external anatomy, the base is on the superior side of the heart. The apex is the inferior point of the heart. The right auricle is a little ear that sticks over the atrium, and the left auricle. Back to the posterior side, we can appreciate the coronary sulcus, which separates the atria from the ventricles. Anteriorly, we can appreciate the anterior intraventricular sulcus, and of course the posterior interventricular sulcus. Exploring the internal anatomy, we have the right atrium. At the base of the right atrium, we can see the remnants of the tricuspid valve, which leads into the right ventricle. And because I cut into it a little strange, I opened it up on this side so that I could appreciate it a little more. Over to the left side, we open up, and we can see the left atrium, which is at the top, this chamber. The left atrium, the top chamber. And at the base of this, we can see the remnants of the bicuspid valve, also the mitral valve. And that leads into the left ventricle. If we look at the anterior portion, we can really see the interventricular septum, meaty part. And from this aspect, we can appreciate the chordae tendineae, the left ventricle. And on this side, they're a little harder to see, but you can see the chordae tendineae as they're attached. These attach directly to the papillary muscles, which are in turn attached to the trabeculae carneae. So while we have it open, we can see the epicardium, the myocardium, and the endocardium.